It's 5:10 p.m. and you still have a patient in the room, half a dozen unfinished notes, and you're thinking, I'll catch up later. You won't. And the thing is, nobody quits physio in a dramatic blaze of glory. No meltdown, no big speech, no rage quitting. Physios fade away, drifting into something else, squeezed out like a bit too much toothpaste. Same moment, different day, repeated enough times, it stops feeling like a problem, it starts feeling normal. And here's the part nobody really talks about. It doesn't start with burnout, it starts much earlier. It's like never reaching overhead and then suddenly you realize the upper cupboards are out of reach. In the clinic, most physios see this loss of range with paperwork. Major point number 1, the second shift. Physios see writing notes as a time management issue. They're not. It's a structural overflow problem because in theory you assess, you treat, you document all inside the same session. In reality, it's back-to-back patients with no breathing space. So everyone builds a survival system. Scrappy little notes during the treatment, mental snapshots, quick scribbles between exercises. I've seen everything. My buddy folds up a sheet of paper into grids. I used to use index cards. I'm still a clipboard-loving guy. And yeah, they all work, kind of, but only as temporary mental storage. Because by mid-afternoon, you're not documenting, you're buffering. And by 5 p.m., you're not writing notes, you're reconstructing your entire day from fragments, while your brain is already fried. That's the second shift. Unpaid, unplanned, and completely normalized. And that's what breaks under pressure. This is you hitting your end range. Major point number 2, cognitive fragmentation. Because it's not just the notes. Notes are just the problem that shows up first. The real issue, this cognitive fragmentation, that's scrambled thinking that physio school never prepped me for, because you're not doing one job, you're constantly switching between clinical reasoning, communication, admin, insurance, supervision. It's like too many browser tabs opened all at once. Nothing fully loads. No closure at the end of the day. It's a system designed to wear you out. Everything becomes just a little bit more superficial, a little bit more automatic, and the system is perfectly happy with that. The system doesn't want your best, it just wants the boxes checked. That's burnout. This is what loads of physios miss. They think they're just tired again and again, but really they're putting one foot out the door. Major point number 3. Why physios leave. So when people talk about why physios quit, it usually gets reduced down to burnout, pay, limited career progression. Yeah, it's all real. But they're all surface labels because most physios don't wake up hating the job. They wake up realizing this is not the job I thought I was doing. This is what experienced physios do differently. It's clarity. It's seeing the patients clearly through the noise. That's why I think of that scene in The Simpsons when Homer has that do it for her sign at his desk. That's the military why are you here question. That's your anchor. Action point, the real fix. So what do you do with that? You don't fix the 5:10 p.m. problem at 5:10 p.m. You prevent the backlog that creates it, and that comes down to 2 things. Number 1, real-time closures, because notes aren't the afterwork. Notes aren't administrate. They're part of the care. And if you're always staying after hours to finish your notes, you're not running your day properly. So the principle is simple. If the patient leaves, the loop is closed. It took me 30 years of physio, but I built templates for 80% that never changed, and then just personalized the 20% that did. What matters is simple. No unfinished clinical stories sitting in your head at 5 p.m. Number 2, pattern-based thinking. Stop resolving everything. The other source of burnout is rethinking the same problems like they're new every time. Most physio is the same problems with different patients. It's true. And sometimes it's the same patients with the same problems. That's true. After a while, you start seeing the patterns. Overuse injuries that creep in over time, trauma with clear trigger, systemic, where the body's baseline has shifted. Treatments follow predictable flow. Phase 1, pain management. Don't poke the bear. Educate hurt versus harm. Pain-free movement. Phase 2 is recovery of motion. Get them functional again. Phase 3, strength, balance, mobility. Build capacity through graded exposure and function. That's it. You're not reinventing care every time. You're recognizing where you are in the process. And that's what makes the day lighter. Not the cases easier, but fewer unnecessary decisions. So the 5:10 p.m. problem isn't really about time, it's about unfinished loops, clinical loops, cognitive loops, meaning loops. When they stack up, you don't feel the burnout all at once, you drift. And that drift is what eventually pushes good physios out of the profession. Not one big decision, but 1,000 small days of unclosed loops. Because over time, you start biting off more than you can chew, Not in the big obvious ways, but in the small unfinished pieces you carry forward. So the goal isn't working harder, it's stop carrying unfinished patients in your head after they've left the room, because that's what actually breaks you. Not the workload, but it's the quiet weight of patients you couldn't leave at the door. My 2 books are now available at Amazon. What They Don't Teach You About Documentation in Physiotherapy School, a short how-to manual for successful daily note templates, and From Injury to Recovery Through Exercise, simple functional exercise progressions for physiotherapists to restore lifting, standing, walking. Thank you for your support. Prepare to be wowed by what you're about to see, this video right here, and subscribe to embark on a journey of relentless progress. Thank you.